Rami has a question.
Yeah, Rachel. So I learned from Rachel, and I just started doing this whole social media. I was not even on Facebook. This is how uncivilized I am. But I noticed between the three that only Instagram is getting me patients. So I saw that you didn't really talk much about it. Only Instagram is growing, and we actually got 4 new patients from Instagram, much more than Facebook, which I didn't expect. Do you have any comments?
I do, and I think you're on the right track. Actually, my marketing people and I were just talking about Instagram. So I do not. I'm there. I'm there as an individual, but not as a business. The dermatologists and the plastic surgeons are all over Instagram, so I don't know how much at this meeting where we've got oncology and other people here. But when it comes to bariatrics and electives, I think that you're on the right track with that. It's a growing space, and younger people than Facebook, for sure.
Thanks, Rachel. Okay, pushing along with concepts with technology. Next, we have Heather Flannery, who's the CEO of Obesity PPM, and Heather's going to talk about blockchain. How many people know what blockchain is? How many people have heard of Bitcoin? Okay, so more people have heard of Bitcoin than blockchain. Blockchain's the technology that Bitcoin's based off of, and I'm probably stealing your thunder, right? So no. But anyway, Heather's one of these kind of scary smart people. So Heather, I'll ask as you talk down. We got a bunch of surgeons here, so make sure that you level your conversation to that level. You know, we're just above plumbers. I'm just kidding. Anyway, Heather's going to talk about blockchain. Thanks.
Thank you, Dr. Wilson. That was a little embarrassing, but it's a great honor to be here with all of you today. And I'm excited to hear that a lot of you know about Bitcoin. And as is that better? Louder. Okay. I can project, that's for sure. It's wonderful to know that a lot of you know about Bitcoin. And for those of you that have been following what's happening in the financial services sector, you may be aware that initial coin offerings or cryptocurrency-based fundraising mechanisms far outstripped all venture capital combined in the calendar year 2017. So we're talking about something that has massive momentum behind it, but is as of yet generally not in production. So what you've got are hundreds and hundreds of really well-funded technology projects going on all over the world that by and large have not hit mainstream yet. Many of us in this space have decided that 2018 is the year that systems long under development go into production, and expecting a lot of exciting news. So in order to understand blockchain, you first have to have a very, very brief primer in encryption. Now, encryption takes plain text, it encrypts it according to a certain kind of mathematics, and then it is decrypted back into plain text. When encrypted text is moved from point to point in transit, it cannot be read, interpreted, or manipulated in any way. This is actually, though, quite old technology. Nothing new about encryption. However, blockchain took this idea and did something very interesting with it, which figured out a way to create an intrinsically longitudinal data structure, where you have an encrypted piece of text that gives you a key, and then you create a new encrypted piece of text incorporating within it the key from the last transaction, and so on, such that you actually are not only encrypting a data set, which has been done for decades at this point, you're connecting a transaction to another in time. And in that connection, you're also able to transmit vital metadata, like the origin or provenance of that data, who came up with it, who was the last person to edit it or revise it. This is a similar concept to a hashing algorithm, but different. A hashing algorithm is just a little piece of software that conducts a math problem. There's lots of different kinds of encryption and cryptographic mathematics, but that's essentially what it is. So as data is moved into a blockchain system, it's moved through a hashing algorithm in order to then become liquid, if you will. So It is, in addition to combining encryption technology, like we talked about, it's using another piece of relatively old technology in order to manifest this thing we call blockchain, and that's distributed systems architectures. So if you remember long ago and far away, you had mainframes with clients. That's the ultimate centralized model. All your data lives in one giant system and you're only able to view it. Then most of us grew up in the client-server era of technology. And over time, servers themselves began to be more distributed, where copies of information were synchronized across databases and so on. And in the last 15 years or so, distributed databases that are running all around the world and using encryption technology have been emerging and enabling a lot of the scalability that allows some of our favorite large-scale, Internet 2.0 applications we all live on to actually function. But encrypted distributed databases did not blockchain make. It was that core innovation of figuring out how to connect and create a longitudinal data structure that really is revolutionary. So I want to talk for a moment about how blockchain works. This is a very high level abstraction of something that has lots of variables underneath it, lots of ways that it can be modified or changed to address different business or clinical use cases. And money is used here because everyone in the room is familiar with Bitcoin. But you can think of money in the case of a digital currency as just a known data set. You can imagine that as a medical record, the results of a lab, a medical image, anything at all. It's just it's a piece of digital data that is actually signed. So someone wants to send that piece of data from one point to another. The transaction is created into this thing called a block, where we're talking about nested encryption that connects it to the provenance, the time, the rest of the metadata about it. That block, once it's created, is broadcast among participants in the network that actually move it through a consensus protocol. That basically means that underlying blockchain, there are participants from a technology perspective in the network, and there are different ways that those participants all decide that they agree that this is valid, that this is true, that this meets business rules that the participants might have agreed to. And based on that consensus protocol, it actually creates a resilient system where you have the majority of the networks, the majority of the participants in a network have to be honest actors. But you actually can continue to move processes forward when there are a small number of dishonest actors, and the technology through the consensus protocol actually prevents fake or fraudulent transactions from being persisted or committed to the blockchain. This is an incredibly important idea because it allows large-scale data transmission to occur, sometimes between parties that don't know or trust each other. What they trust is the math. In math, we trust. An important thing to know is that while there are not very many blockchain systems in production in the healthcare sector in 2018, in financial services, they are absolutely everywhere and in full-scale production. So we're expecting that to come quickly. So here's a couple of ways to understand the IT systems that you're accustomed to today and how they're different from blockchain-enabled systems. First of all, traditional IT systems, as you all probably know, are highly complex and opaque. It's not easy for you to know how they're secured, whether they're secured, and it usually comes down to just trusting the brand of an institution when you determine that something is safe. Now, by contrast, blockchain-enabled systems are cryptographically verifiable. And that means even if you or your software didn't verify something today, anyone can go back in time and have a clear audit trail. And that audit trail is reproducible and will be identical for every party that ever goes and wants to look at that chain of transactions going backward in time. In traditional IT systems, no one really knows when a transaction occurs unless there's some kind of notification function built into it. In blockchain, the transactions are transparent and fully auditable, and all the participants in a distributed network are automatically aware of every proposed and every verified transaction. Consensus is a concept that really doesn't even exist very much in traditional IT systems, but is at the center of blockchain technology, where if multiple stakeholders are dependent on a business or clinical process running correctly, there is actually a method to say, yes, we all agree, this is true, this is in accordance with our laws, this is verifiable, this meets with our jurisdictional framework. Records. So some people call blockchain a database, and that gets a little bit confusing because it kind of implies that all the things that would live in a database that you'd think of today would live on a blockchain. And that's not true. That wouldn't scale. It's not really a business viable model. However, it is a database of pointers to data that lives in other systems. So I like to call it a meta database. As a way of conceptualizing how it relates to data that lives off of blockchains. Traditional IT systems don't have any means of governing the data that goes into them other than the structure of some original database. With blockchain systems, data can actually be transformed and normalized before it's persisted, which is why people talk about how important this is going to be to finally achieving longstanding goals around health data interoperability. A very important idea with blockchain technology is that not all blockchain technologies have anything to do with cryptocurrencies. Not all of these technologies require a token or a coin. So it's unfortunately too easy to conflate these things between token-dependent use cases or the use of cryptocurrencies, and even all of the high drama going on around trillions of dollars of fundraising happening in a very short period of time with cryptocurrencies. There are essentially two categories, public and private. The most popular public blockchains, and Dr. Wilson helped me out with Bitcoin, absolutely, and the other one is Ethereum. There are many others. They use proof of work or proof of stake, which is a certain kind of mathematical problem solving. We're not going to go into that now, but happy to take questions on it. And there are also private blockchain technologies that don't use any kind of token or any kind of cryptocurrency, but do use the underlying longitudinal data structures we're talking about, do leverage the security and the privacy associated with the novel encryption, and have a number of other benefits. Before I close out, I'm going to be talking about how I see the relationship of these things disrupting healthcare in stages, in milestones. But essentially, one of the most important things to know about private blockchains is they do not require any kind of cryptocurrency or token in order to function, and they are ideal for entities or institutions that have pre-existing business relationships. For example, a payer and a provider, or a patient and their relationship with a healthcare delivery system, where entities are already known and trusted, and where you don't need a cryptocurrency. You're able to use private permissioned blockchain technologies, I believe, much sooner, including as soon as 2018, than large-scale public-oriented use cases are going to be viable. This is just to give you a sense of how far along things are in financial services. And I think a couple of years from now, looking back, we're going to see healthcare brands that you know and trust, from payers to providers to med device to pharma, regulators, HIEs, that you're going to see up on that as having occurred in 2018, 2019, 2020. So one of the things that I think is an important point is when we think of data, what we typically conceptualize as copies of data everywhere. Copies of data that are slightly different, copies of data that are under different governance models that exist in different software applications. The key here is that imagine that an individual piece of data could be controlled and known in the same way that an object could in a supply chain with a bar chart on it. It gives you a way to tag and identify a single unit of data, as well as the data about that data. and have that be intrinsically longitudinal. If you think about as healthcare providers and healthcare professionals, the amount of work that goes into trying to reconstruct longitudinal data that is trustworthy and accurate, it's an enormous amount of effort. So blockchain has the potential to save time, reduce costs, reduce risk, and definitely to increase trust. These are blockchain use cases that there are probably as many as 200 different companies working on right now. Some of them already have identities and brands launched. Some of them have proofs of concept or pilots stood up. Almost everything, though, is still in a developmental stage. So precision medicine is continuously being discussed, where in terms of the intersection of genomics, of wearables data, and of patient-centered or patient self-sovereign health data, where really for the first time patients can control access to their health data, though not necessarily change it and modify it themselves. Value-based care with the ability for real-world evidence to be used in reimbursement contracts. One major challenge with value-based reimbursement is verifying that the value was actually achieved. And that has to do with dirty data, data that is having to be collected and transformed and manipulated in many ways, and there's a lack of trust around that. Data persisted to a blockchain would not have that characteristic. The parties in the network would be able to audit it at all times, and it would not be editable in hindsight. Cybersecurity is absolutely critical. In our healthcare culture, we didn't grow up in healthcare being under full-scale, nation-state level cybersecurity threat. The health sector is now under full-scale attack that's been escalating for the last approximately 3 to 4 years, and it's now to the point where the health sector has to protect itself and defend its interests, much like governments have had to do historically. And there's not a tremendous amount of help from our governments in getting that done, but there is a huge amount of liability for breaches and other circumstances. So adoption of this technology gives us an additional layer of trust. It is not a panacea. It doesn't solve all cybersecurity problems, but it definitely improves over baseline where we stand today. The whole idea of a centralized health information exchange is something that has the potential to either be greatly improved upon or potentially completely disintermediated using blockchain technology. And that is a so a couple of other points I want to get to before we run out of time. This gives you a good view of all of the data origination points between in the patient context as well as the provider context, how that moves onto a blockchain, and where you see the silos for data lakes. It's important to recognize that's off-chain data. The blockchain itself actually contains encrypted pointers, permissions, metadata that allows you to move this back and forth. And ultimately, research organizations, med device, pharmaceutical, payers, regulators all have the ability to get access to, controlled and secure access to information that they need to do their jobs well. So this is my personal view of what we're going to see if trying to be a prognosticator here. I think in 2018, 2019, we're going to see large-scale adoption of private permissioned blockchain networks, and that there are pretty radical and exciting benefits that are going to be derived by that. But there's a much bigger benefit that's going to be available when patient self-sovereignty kicks in, and there's a lot of cultural changes required to make that happen. And ultimately, all of these blockchains that we're talking about, they have to be interoperable. They have to talk to one another. So eventually, we're going to see hybrid convergence across blockchain technologies combined with patient self-sovereignty, and that's when there will be things legitimately revolutionary happening. And then the last idea I'd like to leave you with is that this technology innovation does not live in a vacuum, and it happens to be maturing at the same time that a number of other equally disruptive, equally revolutionary technologies that have been incubating for 5-10 years are all reaching points of commercial maturity. I don't believe this has ever really happened in human history. It would be like the integrated circuit, the steam engine, and the Gutenberg printing press all manifesting in the same 5-year interval. So there's a great deal of unknowability about what's going to be possible and happen with the convergence of these things: machine learning, natural language processing, robotic process automation, all under the AI umbrella, biotech and Internet of Medical Things, with massive advancements all converging. Distributed ledger technology or blockchain technology is the core enabler that will allow the data that can be generated and moved about from all of those convergence to be trusted, to be auditable, and really to be viable for business and clinical utility. That's it.
Thanks, Heather. Todd has a question.
This versus from a perspective, huge buzzword, everybody wants to hear about AI. The signs may be drug manufacturers.
Yeah. Yeah, so that's an excellent question. I'll use an example that the Centers for Disease Control is working on that's actively in a pilot. They have an influenza surveillance and monitoring program that you're probably all aware of for reporting diagnosed cases of influenza. It is a great challenge in terms of running that registry to have consistent, quickly reportable, verifiable data. They spend a number of headcount doing analysis. So they've got 3 people that do full-time analytics on that data all the time, mainly because the data itself is poorly structured, inconsistent, has a number of challenges with it. So without a token and without a cryptocurrency, their vision, and again, this is at proof of concept or pilot level, their vision is to be able to have immediately trustworthy, instantaneously delivered real-time analytics against continuously updating disease surveillance. So there are a number of use cases in clinical trials and research administration that will aid in reproducibility, that will lower costs and improve data quality. There are use cases really in just about every segment of healthcare. I'm very focused on enabling connected care and complex chronic disease management and implementing clinical integrations and moving patient data across organizational boundaries quickly and securely. I don't know if that's helpful. Could you repeat that question?
I know. I'm glad I got the words right. I think it's hard to remember.
Well, so blockchain isn't a panacea. It doesn't solve the garbage in, garbage out problem, for example. But what it does is control and standardize data and verify it as it's being produced. And it allows you to execute business logic or clinical rules, what have you, on the blockchain at speed. So you have the ability to make processes move more quickly in a greatly elevated level of trust. So that one of the reasons the processes can't move that quickly today is because there's human beings and many, many enterprise systems involved in verifying step 1, step 2, step 3 of a process. With blockchain technology, large amounts of that can be automated without sacrificing data integrity or trust in the data that's being captured and moved about and decided upon.
We were talking about this last night, and I oversimplified it by saying it's like figuring out a way, utilizing this technology because it's transparent, verifiable, to eliminate middlemen, basically. Do you agree? So could we use this to get rid of insurance companies, for example, like healthcare insurance companies?
So large-scale disintermediation is being threatened by a lot of really idealistic blockchain advocates. Personally, my opinion is that that's unlikely to happen. There may be a few scenarios where disintermediation will radically change, but I think what's much more likely are that the large trusted brands that we work with today are going to adopt this technology in order to save money, increase speed, solve a number of challenging problems. But
What if they're untrusted brands like insurance companies? And can we utilize them to make them more trusted?
so one of the challenges with, if you were to get rid of third-party payers in general, one of the challenges with that is the enormous scale of what would be the equivalent of claims adjudication. Yes, this technology theoretically could enable that. So on the subject of private practices, for example, you could argue that this technology will make private pay models much more viable and accessible, and that is a threat to the health insurance industry for sure.
Dave, that's one question.
So, I have, I go to the rodeo with them tomorrow, or to buy a bull.
Oh no.
I want them
Mm-hmm.
how, what needs to allow blockchain to change?
So could blockchain be utilized to create a common
Yeah.
pathway for healthcare information?
What needs to be done?
Yes. So you're referring to patient self-sovereign data, where a patient can collect their health information from providers.
The doctors and emergency
And right. Well, so if you want patients to have the control to say, I give access to this new emergency room or to my some trusted delegated person. Okay. So what needs to happen is that there are data standards like Fast Healthcare Interoperability Resources, or FHIR, that are from the HL7 Foundation. So the same kind of challenges that have always needed to exist with health data interoperability still exist in blockchain. But now what's different is that the value proposition for actually achieving that interoperability is much stronger. There's more that can be done. The real reason we don't have interoperable health data today is not because we couldn't accomplish it at an engineering level. It's because no one could pay for it. No one organization or institution was willing to bear the burden of converting their data models over to a standard. Well, now there's a number of regulations converging. You finally have Cerner, especially, and Epic, slightly less so, coming along in terms of interoperable data. But the idea will be that you will have a self-sovereign health record. There are a half a dozen companies that are selling blockchain-enabled self-sovereign data records right now already, and there's many more coming out. So there, yeah, yeah. So one thing, I live in Washington D.C., and it has given me the ability to get pretty integrated with our federal agencies involved in these problems, and I've been extremely impressed with how forward-looking they are and thoughtful they are about wanting to support innovation. They're trying not to be heavy-handed about it, but ultimately, yes, there will be regulatory forcing functions. I mean, right now, the fastest thing happening in healthcare is due to the Pharmaceutical Supply Chain Visibility Act and the timeline that Congress set with that. That has created a massive flurry of activity to drive compliance, and blockchain technology is literally the only mechanism by which compliance is possible. But there's more coming from the Office of the National Coordinator for Health IT, the National Institutes for Standards and Technology, other standards bodies like the ISO, the IEEE. IEEE, for example, is working on a standard for clinical trial data. So it is going to take a broad effort to make it possible, but the core technology is there. It's there.
Thanks, Heather.
Yep, thank you so much.
See, I don't think I was overstating that you're scary smart. All right, we're going to take a quick break. Come back here at 2:50. We've got about 20 minutes. Please go by Picasso 2 and say hi to the industry people.